Hi everybody, Tom Fiala here, board certified plastic surgeon in Orlando, Florida. Today's reader question is, Dr. Fiala, what options are there for my unsightly neck? Okay, well, it kind of depends on what is causing the problem, because there are several options here. We could consider liposuction, we could consider surgical neck lift, we could consider radiofrequency treatment of the tissue, or maybe a chin implant, depending on what's going on. So, going back to the first one, liposuction, if the person has a double chin, but good skin elasticity here, for example in the younger patient, liposuction of the extra fat underneath the skin can be done to remove the double chin and make the neckline look much improved. However, if the skin is really loose and floppy, to talk about the typical turkey gobbler type situation, then liposuction is probably not going to help that by itself. Some sort of surgical tightening is going to be required, with either a neck lift or facelift being done to reposition and tighten the tissues and reestablish the nice neck angle and jawline. If the chin is weak and the bony structure would look better if it was a little bit more forward, many times we'll consider using a proportionally sized chin implant to reinforce the shape of the chin. And for somebody with a weak chin, that can be done, and sometimes at the same time as having liposuction done, and that combination can also look quite good. Last but not least, there's a procedure called ThermiTight, which is a fairly new radiofrequency treatment for people that have just a little bit of laxity underneath here, but not enough to consider doing a facelift for them. And we can use the small probe that goes behind the backside of the skin and put radiofrequency heat into the tissues and get a little bit of tightening of the neck skin that way. So that's a relatively new technology that we've been working with over the last couple of years, and we're starting to see some really nice results with it. So lots of choices, and again, the best way to figure out which one you need is to come on in for a consultation, and I'll be happy to evaluate you and give you an honest assessment of what I think is going on for you and what would actually work and give you the results that you're hoping for. Okay, thanks.